Hello everybody and thanks for joining me. I'm Leininger and I'm here to present my cultural care theory. A little bit about myself. I was born in Sutton, Nebraska, and I started my nursing career pretty early on. I started at St. Scholastica in Kansas to obtain my BSN, and thereafter went to Catholic University in Washington, D.C. to obtain my MSN. After that, I went to the University of Washington to obtain my PhD in anthropology. Early in my career, I had somewhat of a cultural shock working in a child guidance home, and that's when I started to realize that patterns of behavior that were linked with cultural beliefs. And that's what kind of started out my research and thinking about cultural congruent care. I have about 60 years of dedication to nursing studies, and I had developed the Sunrise model in 1997 to depict my cultural care theory. I've also wrote and edited about 27 books to educate others in hopes to continue this theory in nursing practice. My theory is a mid-range theory due to the fact that I narrowed in on the view of the beliefs of patients, and we are able to use empirical data and test out my theory in real-life nursing practice. I prefer to use nth know methods to study nursing care, which is a way of studying people's everyday lives and understanding how they perceive the world. I wanted to compare caring behaviors and values between different cultures in the world to show the differences between individuals and how altering the care provided can lead to better patient outcomes. Key points in my theory. Care. The idea related to encouraging behaviors towards others that will improve one's condition, while caring are the actions taken to encourage these behaviors to actually improve the condition. Culture. Values, beliefs, or lifeway practices of a particular group that guides their thinking and actions in a type of pattern, while cultural care is being aware of one's culture and using that to shape the care given to enhance a human condition. Now, when we think of the idea of cultural care diversity versus cultural care universality, we think diversity is the variability of meaning and healthcare patterns between people, while universality speaks to the common or similar healthcare practices between individuals. And the only way to figure this out between your patients is to actually sit down and have a conversation with them and find out what kind of healthcare practices or cultural values they incorporate into their everyday lives. Key points. Cultural congruent care. Assistive or enabling acts or decisions that are specific to an individual's group's cultural values. Preservation versus maintenance. Professional actions taken to preserve or maintain someone's cultural views while providing health care. Accommodation or negotiation. Actions taken to accommodate a patient's cultural beliefs into the care provided, or find some kind of negotiation between us to still meet that healthcare outcome. Repatterning or restructuring. Actions taken to help that patient modify their health behaviors to improve their outcomes while maintaining their cultural beliefs. The four key terms of a theory are person, health, nurse, and environment. In my theory, person, my theory focuses on all people as cultural beings, looking at their social structures and worldviews. Health and illness. I'm looking to see each person's perception of illness, how one sees the world as it relates to health and illness aspects. Nurse. The role of the nurse in my theory is how they are able to incorporate their patient's culture into the care they are providing. While environment, we are using a social structure. I am able to view a particular experience or situation that renders some type of meaning for that patient. In a nursing research study, I found that Zuka and Husted have used my culturally congruent care theory as framework for their research done out of Pennsylvania. The article they have provided, The Ethical Dimensions of Delivering Culturally Congruent Nursing and Healthcare, quoted, "We defend the position that a patient's culture is only a useful tool in caring for a patient if the individual person is made the primary focus of care." And pictured on the right is my Sunrise model, which depicts the theory of culturally congruent care. Zuka and Husted's article is a study that discusses the cultural views on healthcare between Mexican Americans who suffer from depressive-like symptoms. They used my theory to show the universality and differences between people of the same culture. Culturally congruent care is patient-specific. Not all members of the same culture practice the same healthcare rituals. In the article, it discusses a husband and wife who share the same culture, but they have different healthcare practices. And by putting the patient at the center of care is determining how you as a nurse will deliver culturally congruent care. Patient scenario. At Children's Hospital in the neonatal intensive care unit, there's a premature baby born at about 24 weeks. At the time, the infant was about 3 weeks old. The mother and father were of Muslim religion, and the problem we were facing was providing kangaroo care. Women of that faith are only allowed to have the skin of their face and hands be shown. And in the NICU, it's about a 6-bed room and other families were visiting. We have explained the importance of kangaroo care for the infant's health, and the mother was willing to try if we were able to accommodate her needs. The father and the sons left the room, and we found 3 large dividers and set the mother up to maintain her privacy. Once the baby was on skin, we covered her back up with a light blanket so no skin would be shown other than the baby's head. The baby had received the best care and the family was comfortable, and the cultural values were maintained. We were able to accommodate the patient's beliefs and be able to meet our healthcare outcomes. Thanks for joining me today. Please don't hesitate to ask any questions in your replies. Thanks for taking the time to listen to my presentation.